Well, we're here at this impressive meeting. Martine Piccart, what are you expecting to come out of this meeting? What are the big highlights?
So, as you know, the IMPAKT conference is a meeting which is focusing on latest developments in translational research for breast cancer, trying to teach young oncologists what they should know to treat patients in the coming years. And it's also a conference where we extensively discuss better ways of developing new targeted drugs and biomarkers. So this year, I think the IMPAKT conference will focus a lot on tumour heterogeneity. So it's becoming very clear that with the use of the very powerful new technologies, we can get a much better appreciation of the complexity of these breast tumors. You know, when I started oncology, I was talking about two forms of breast cancer: the breast tumors expressing hormone receptors and those not having hormone receptors. Today it looks like breast cancer will become more than 10 different diseases perhaps, and with the new technologies available, we should be able to understand the disease evolution much better. You know, what is the difference between the primary tumor and its metastases? Are metastases all alike or are they different? But the big challenge will remain to identify a driver mutation in the tumor that we can target with drugs. And here, of course, we need more research because...
Now that's been the case for a long time, but for example, in hormone receptor expressing tumours, there are differences, and you now have some insights into what those differences are. Could you illuminate some of those for me, please?
So, among the hormone receptor positive breast cancers, we already know that we have two different classes: the tumours that grow slowly and the ones that are highly proliferating tumours. But we are going to go in more depth with new technologies and possibly identify in these two classes some very specific molecular characteristics that will lead to new forms of therapy. So the future will probably be combination of endocrine therapy and some of these new targeted drugs.
And what is it about the microenvironment that you're beginning to understand that helps you have this sort of hope that you will in fact crack this complexity that you've just mentioned?
Well, that's going to be among the most fascinating news at IMPAKT. It's really the recognition that the host immune system plays an important role in this disease, as it does in some other cancers. And that is becoming particularly evident for HER2 positive breast cancer, which is one type of breast cancer, and also the triple negative breast cancers, where we think that the immune system can contribute to a very good outcome. So the next challenge will be to see what we can do when patients have an immune system that does not work well. What kind of strategies could we then implement to correct this?
And can you explain to me how next generation sequencing is helping you to achieve some of these hopes and goals?
So next generation sequencing will of course focus on the tumor and on the host. So we are going to confront the analysis of the DNA of the tumor and the DNA of the host. And as I was explaining, this might speed up new drug development if we manage to understand which are the key molecular abnormalities in the tumor, the ones that are really responsible for the really bad behavior of the tumor.
Right, there are some ifs and there are some mights in there. Could you pick out for me some of the more promising things which will help you get on top of this heterogeneity that you're faced with, this complexity? Is there some light at the end of the tunnel? Have you got some favourite mechanisms that you would point us to which could have clinical implications?
Well, we clearly do have now a number of drugs that are targeting some of the mutations that we can identify in these tumors. So I believe that very soon we will, in routine clinical practice, need this information to select the best treatment for our patients.
So what are the particular points that you'd like oncologists and practicing clinicians to remember, potentially coming out of the IMPAKT 2012 meeting?
Well, my advice would be for them to try to stay tuned with all these developments, because they are happening at an extremely high speed, and they will probably have a very big impact on the way medical oncology is happening on a daily basis. So it's now the time to try to understand this new knowledge, so that in a few years from now they will feel at ease with the new developments in their profession.
So there is a real hope that this will help you treat your patient?
Yes.
Martine Piccart, thank you very much indeed.